Still connecting. You're live.
Hello, welcome to Albion and the Community's World Cancer Day Q&A. We're going to talk about cancer screening and understanding the signs and symptoms of cancer. We're the Speak Up Against Cancer team, and we raise awareness of cancer across the city. 1 in 2 people will be diagnosed with cancer in their lifetime. The good news is that 90% is treatable if diagnosed early, and that's why we're here today, to share the message that early diagnosis saves lives. I'm really pleased to introduce you to the Speak Up team and guests. Ian and Carolyn, our Speak Up team. Kirsty and Stephen, our Speak Up volunteers. And Chris Penny from the Specialist Screening Bowel Service. So why is speaking about cancer and understanding signs and symptoms important? Well, in the UK, 1 in 20 people will be diagnosed with bowel cancer each year. 1 in 8 women with breast cancer, and cervical cancer is the most commonly diagnosed cancer in the under 35s. In fact, cancer is responsible for around 1/3 of premature deaths in the city. But 90% of cancers are treatable if diagnosed early, and being aware of signs and symptoms and attending screening can increase survival rates and save lives. We're going to explore some of the key questions this morning on this important issue. Our first question is for Kirsty, one of our Speak Up volunteers and a cancer survivor herself. Kirsty, could you please tell us why you volunteer and why it's important to understand the signs and symptoms of cancer?
Yeah, given that cancers are so much more treatable if they're caught early, I really wanted to contribute to giving people the awareness and knowledge that they need in order to be able to do something about symptoms if they experience them. And also by being completely open and frank about my own bowel cancer, which I'm afraid involves talking about things like bottoms and poo, I'm hoping to be able to break down the barriers, or at least some of them, that prevent people from seeking help if they have these symptoms. And also prevents them from taking advantage of screening, which can be seen as embarrassing. So to understand where I'm coming from, I'm going to tell you what happened to me briefly. In 2014, I was on an exotic holiday, 2 days into a lovely, beautiful place in the Caribbean, when I discovered, because it was a place with delicate plumbing, so we had to throw loo paper in a bucket rather than flush it down, blood. So I was bleeding from the bottom. And that is one of the main symptoms of bowel cancer, but I didn't know that at the time. And frankly, I didn't really want to know. It wasn't going to spoil my holiday, so I just ignored it. This continued sporadically when I got home. I still didn't do anything about it because I was embarrassed. I didn't want to go there. Subsequently, a few weeks later, I started noticing changing bowel habits, which is also a symptom of bowel cancer. And I eventually plucked up the courage and went to my GP, who immediately referred me to hospital. So I had a series of tests and all of that, and eventually was diagnosed with stage 3 bowel cancer, which meant that, you know, it had gone a bit further than it should have done. I had a series of, you know, tests again to establish exactly what had happened, and eventually I had surgery to remove a large chunk of my bowel along with the tumor. And this left me with an ileostomy, which is a stoma bag, which is there to collect poo outside the body. Fortunately, that was temporary, but I had it for 9 months. And because they also discovered cancer cells in a lymph node, just one lymph node, but that's enough. I was offered a course of chemotherapy, which I went through, and everyone who's been through chemotherapy knows that it's tough. The good thing about all this is that in the summer of 2015, I had finished all my treatment, my stoma had been reversed, And I then had 5 years of regular checkups and so on to make sure I was okay. And the really good news is that last year I was declared fit and well, cancer-free, discharged from hospital, and you know, yeah, as you can see, alive and reasonably well. May not be obviously obvious. So to recap why I want to volunteer, this is where I'm coming from. I don't want other people to go through this if it can be prevented by early detection. And I know that bowel cancer in particular is awkward, and other cancers in sensitive places like prostate and bladder and cervix and so on. And people are reluctant and find it awkward to talk about. And by really breaking down these barriers, I'm hoping that people will understand the importance of going to the doctor and to take up the office of screening. And the message is really very simple. I'm saying this to everybody: please don't die of embarrassment. That's it. That's my message.
Thank you so much, Kirsty. The message is really clear, really shows how important it is to be aware of the signs and symptoms so we can get help early and increase our chances of survival. Thanks, Kirsty. Our next question is for Carolyn and Ian, who are our Speak Up project team. Ian and Carolyn, could you talk a little about early diagnosis and survival rates? Thanks.
Yeah, sure. Yeah, thanks, Vanessa. Look, we know our bodies better than anyone. So if we know the signs and symptoms to look out for in our own bodies, and Kirsty's mentioned a few already, we can get medical advice at an earlier stage and cancer's treated more quickly and effectively, which is good news. The thing is, cancer can be diagnosed at different stages, and the stage of cancer is diagnosed at will impact on our chances of survival. So when we look at survival rates, we do actually see really big differences from being diagnosed at stage 1 compared to being diagnosed at stage 4. I'm just going to give you a couple of examples that are really important to share with you. Breast cancer, for example, the 5-year survival rate, if it's found early at stage 1, is actually 98%, whereas the comparable 5-year survival rate, if it's found late at stage 4, drops to only 26%. For bowel cancer, the figure is actually around 92% if diagnosed early at stage 1, compared to only 10% if it's diagnosed late. Phenomenal differences. And the figure for cervical cancer, again, vast differences: 95% at an early stage and 15% respectively at a late stage. So there's a really strong message there to reinforce Kirsty's point that early diagnosis is crucial. Carolyn, do you want to actually add to that a bit as well?
Yeah, I'd like to add that the screening programs can pick up the signs of cancer at its very earliest stage, and it means that the cancer can be treated before it progresses and becomes more difficult to treat. And as we've heard, early detection means that the cancers can be easy to treat with better survival rates if caught early. So for instance, cervical screening saves around 5,000 lives each year, and breast screening saves around 1,300 lives. And we know that bowel cancer screening could save 2,000 lives by 2025.
Great. Thanks, Carolyn and Ian. So we've spoken about the signs and symptoms of cancer and why they're important, but what are they? What should we look out for in our bodies? Ian, could you go into some detail on this, please?
Yeah, sure. I'm talking through these now. There's actually a number of signs and symptoms to look out for, which are specific to different cancers. More information is available on our website around those. I'm going to share a few with you now, but it's by no means an exhaustive list, by the way. You may experience one or you may experience several. Actually, these signs and symptoms may not necessarily lead to a cancer diagnosis. It might not be cancer, but if they appear, the thing is to look out for. It's well worth getting them checked out just in case, so, for peace of mind. Well, probably we're going to look at the most common 6. Firstly, I would suggest an unusual lump or swelling anywhere on the body. It is one to look out for. For example, this could be a sign of something related to breast or bowel or testicular cancer even. Secondly, you should look out for chest pain, breathlessness, or a persistent cough that's lasted a while maybe. And this, of course, could be something lung cancer related. Another would be changes in bowel habits, for example, bowel movements themselves. And Kirsty alluded to this earlier. Maybe looser poo is a thing to look out for. That's quite important. And blood in your poo as well. So don't be afraid to have a look in the toilet bowl or on the toilet paper, because that could be a sign of bowel or something colorectal cancer related in general. So, and Chris will explain a bit about that later in particular. Unexpected weight loss is important too. So that again could be to do with bowel or lung or prostate cancer again. The fifth one on the list is, I would suggest unexplained bleeding anywhere on the body. And I say anywhere, that's anywhere on the whole body. That could be anywhere, couldn't it? So it could indicate something bowel or cervical or prostate related, or actually it's in the middle of winter, you know, or even if we're out and about, it could be skin cancer related, particularly if moles become crusty and start to weep or bleed. So that's worth a mention as well, particularly when we're out in the sun, whenever that might be during the year. So it's something to bear in mind. Skin cancer is really important too, to look out for those signs and symptoms as well. Number 6, you can round that up by saying unexplained pain that lasts longer than 4 weeks, and that could be anywhere in or on the body, and it could be a sign of, you know, cervical cancer or prostate cancer again, or any other cancer. And there are many to look out for. So just, you know, think about getting checked out, and if you're concerned, the GP is the next point of call. So that's fair enough, Vanessa? Yeah.
Absolutely. Thanks, Ian. So thanks. So we've looked at signs and symptoms, and remember, if you have any concerns around any of those, contact your GP. The Speak Up team is also here to help. So links to our website will be in the comments section today, and you can also find us on the Albion in the community website. So we've looked at signs and symptoms. What about screening, the other path of early diagnosis? Screening is available for breast cancer, cervical cancer, and bowel cancer. Each programme is slightly different, and we'll take a closer look at those now. So Carolyn, over to you. Could you tell us about the different programmes, what they involve, and who they're for? Thanks.
Sound
On mute.
Phrase of 2021 now.
Sorry, I did lose you a minute there. Screening programs are national programs designed to check a well population to detect for the early signs of cancer. Treatment can then be preventative and more successful. Chris will talk about bowel screening in a moment, so I'm just going to cover screening for breast and cervical cancers. So with breast screening, this aims to find breast cancers early. It uses an X-ray called a mammogram, and that can spot cancers when they are too small to see or even feel. Women registered with the GP between the ages of 50 and 70 will receive an automatic invitation in the post. When you receive your letter, you need to call up the screening clinic to book your appointment. Some people will be given an appointment time, but the letter will be clear on what you need to do. Our local screening clinic is in Preston Park, and your appointment should last less than half an hour and be carried out by a female. 1 in every 100 women screened in the UK have their breast cancer detected through breast screening, and around 8 in 10 of these will have invasive cancer, which means it has developed and is growing. Now, cervical screening. Cervical screening is a way of preventing cancer. It aims to find abnormal cells in the cervix that could develop into cancer if left untreated. Cervical screening, sometimes known as a smear test, checks the health of your cervix, and it is not a test for cancer. It's a test to help prevent cancer. All women and people with a cervix, aged 25 to 64, should be invited by letter, and the frequency depends on your age. Women between the ages of 25 and 49 will be invited every 3 years, and women between the ages of 50 and 64 will be invited every 5 years. Screening takes about 10 minutes and is usually done by a female nurse or doctor. And I just want to add, 99.8% of cervical cancers are preventable due to the vaccination and screening programs. So it is important to attend your screening appointments. Thank you.
Absolutely. Thanks, Carolyn. Really important message there, particularly the message around being registered with your GP. In order to be automatically invited, you need to be registered. So it's worth double checking. But if you're not and want some help, contact us and we can give you details of your local surgery and help you through that process. Our link to our website will be in the comments section, but you can also find us at albionthecommunity.org.uk. So thanks, Carolyn. We're going to take a closer look at bowel screening now, and we're really pleased to welcome Chris Penny here today, who's the lead specialist training practitioner for bowel screening. So Chris, over to you. And could you tell us a little bit about the bowel screening service in Brighton and Hove and what people can expect? Thanks.
Thanks, Vanessa. Bowel screening is currently available for people who are aged 60 to 74 and registered with a GP. Now you'll hear a common theme there, register with a GP. If you're not, please do get in touch and get that sorted. You get an invitation every 2 years to do a poo test at home. It's a much easier test now than it used to be. You only have to do a single test rather than 3 and hide the card for a couple of days. That test looks for a trace of blood in the stool. That could be for a whole variety of reasons, and obviously because it's under a cancer program, that's the one we worry about the most. For people doing this test, it goes by post. You send it off in the post, and then you get a letter back telling you either with nothing found, back in 2 years' time, or we need to see you for a clinic appointment. The clinic appointment is to discuss health issues, to make sure that everything's okay in terms of going ahead, and then we'll go through what's involved in the further testing that we normally would have. That's a colonoscopy. Now, for every 100 people that do the test at home, we only see 2 in clinic. The test filters out quite a lot of people. There's nothing to worry about, and you'll be invited again in 2 years' time. For those that come to clinic, we do a health check. We explain what colonoscopy is about, which is about looking at the inside of the large bowel with a very flexible camera to look for signs and symptoms of things that shouldn't be there. Sometimes it's a polyp, which is a skin tag on the inside, and they have potential, so we normally would take those off. Of all the people that we do a colonoscopy on, for every 100 colonoscopies we do, we actually find 9 cancers. So there is quite a pickup from those that come through. Colonoscopy is not the most pleasant experience in the world, but it's not drastic. It's literally, you spend a day in the loo beforehand, and then you spend a day with us full of terrible wind. It's the only place I know you're positively encouraged to pass it. Before you leave us, after you've had your examination, you will know what we've done. So if it's polyps that have been taken off, they have to go to the lab, they get checked out, and then we come back to you and say, nothing to do, we'll look at you again in a couple of years' time or back into the fit testing. If we are concerned for any reason, we will tell you that. There are other tests that we would do. There are scans and x-rays and such like to see what we need to do in terms of treatment. As Carolyn's already mentioned, I think it was, or Ian, that early stage detections, massive survival rates. So it's really, really important to do your test, send it off, don't be embarrassed. I talk about poo all day, my kids think it's hilarious. It's the easy test to do, it's a nice, safe test to do, and we're actually quite human when you come and see us in clinic. Nothing to be frightened of. In terms of the age group, we're 60 to 74 at the moment automatically, every 2 years from your GP registration. If you're over 74, you're still eligible to have a test, but you have to ask for it. And there is a move to bring the age down to 50, but that will take some time to do, and that's hopefully going to start sometime later this year. In terms of screening we like to see people nice and early because we can fix things. It's nice to get peace of mind. It's nice to know that we've found nothing to worry about, rather than to sit at home thinking, now what if, and as Carolyn and Ian both said, the outcome is not so good if it's delayed. And as you heard Kirsty talk about it, she's still here to talk about it, which is great. Thanks, Vanessa.
Thanks, Chris. Could we look a little at COVID-19 and what that means about kind of contacting your GP and screening programs? Some people might wonder, is it safe to attend screening, and do GPs want to hear from people about cancer concerns during the pandemic? Chris?
In terms of GP practices and cancer concerns, yes, they do. It's one of the biggest issues that has been since the pandemic started, is that so many people will have missed their opportunity to get screened because of fears of COVID. GPs are there, they're waiting to hear from you. We're still there, we're still running as a screening program. And what we want to do is find things early. It's a very safe environment. In terms of the process, we don't see anybody in clinic unless we really have to. We normally do our clinic assessments by phone. When you come for your examination itself, there's an isolation period of a couple of days before you have your exam, preceded by having a COVID test yourself anyway. All the staff are tested. The hospital doesn't let anybody in unless they're tested and clear. For example, I've done my test this morning. We get tested twice a week. So it is a safe environment, as safe as it possibly can be, humanly possible. And the idea is that when you come for your appointment, you have to wear a mask, and everybody's used to that now. We wear masks, PPE, places scrubbed out. You might smell a bit of disinfectant, but that's kind of reassuring to know that those precautions are being taken to keep you as safe as you possibly can.
Great, thanks, Chris. Message is clear. Attend your screening, know the signs, see your GP if concerned. Even through the pandemic, cancer is still a priority for the NHS. Thanks very much, Chris. Thanks, Carolyn and Ian. I'd like to invite our final speaker today, and that is Steve, who is one of our Speak Up volunteers, and he's going to share his personal story. Steve's a cancer survivor and has also recently had screening experience. So over to you, Steve.
Thank you. First of all, can I reinforce what Chris was saying about the safety of the screening process? I took my poo test just before Christmas and I failed. I don't fail many exams, but that was one of the ones that I failed. And lo and behold, I had the follow-up letter arranging for me to see a specialist nurse at my local hospital who gave me all the advice and gave me all the background. And then I had to have a colonoscopy. And the colonoscopy, they prepare you for incredibly well. Everything's done. Preparation beforehand, you say a COVID test 3 days before you go into hospital. You have to have a very strong laxative that does empty you out a little bit. So that's probably the worst bit of the whole experience. But going into a hospital, again, masked, tested, it was an incredibly positive experience. I went in at 7 o'clock in the morning. I was home by lunchtime, having had a colonoscopy, having had 4 polyps removed. A 5th one was left in situ because they said it was a little bit too big, but they took histology from it. And lo and behold, last week I had the all clear on all of them. There was nothing that was malignant. So it was all positive news. And this morning they've just heard, and I've arranged to have the 5th one removed in a slightly bigger operation. But again, it's going to be a half a day on the 23rd of February. Now, this was me taking the poo test that I'd been sent through the post. Now, having had prostate cancer 4 years ago, it was one of the things that I was conscious of is I was detected early. I had the luck of recognizing a symptom, which in my case was blood in my semen, and going to my GP. It was quite a long process actually after that in terms of, it was weeks, not days, but eventually after I'd had a biopsy of the prostate done, it was found that I had early stage prostate cancer and there was no other sign. My PSA level, which is a very simple test they do through blood, is only an indicator, and mine was really low. Anyway, the net result of this is I went in and had a minor operation, something called brachytherapy, where they inject into your prostate. I had 128 little pellets put in there under general anaesthetic. And I went in one evening and I came home the next afternoon. I was told to take things easy probably for a week or so. Well, I'm not like that. I actually had 2 days off work and did the rest from home. So my cancer story is a bit like Kirsty's. Recognize a sign, don't be ignorant, face things straight on, and when you get something such as a negative poo test, it's much easier to go through the process and then not worry because there's nothing else left there, rather than stand around, sit around and think at 3 o'clock in the morning, should I do something about it? Cancer is something that will touch almost all of us, either directly or indirectly in our lives. If we've done something about it and we're willing to talk about it, we can help it become less of a stigma and actually less of a problem, because there'll be less people with late-stage cancers. Thank you.
Brilliant. Thanks so much, Steve. Absolutely. That's so powerful. Thank you to you and to Kirsty for sharing your messages today. It's really great to hear your experiences, and also that you're using your experiences to help others and to help other people's lives. Thank you. Just a final couple of messages from the Speak Up team, and then we'll go to questions. We just wanted to mention that Steve and Kirsty both went through our Brighter Outlet programme, which is a physical activity programme that offers free physical activity for people of all ages living with cancer and beyond cancer, and it's available in Brighton and Hove, East Sussex, and some places in West Sussex. We also really have a strong message within Speak Up that prevention is better than cure. And physical activity, giving up smoking, reducing alcohol intake, for example, can all reduce your risk of cancer. And our Brighton and Hove Neighbourhood Health Squad can help with healthy lifestyle support in Brighton and Hove. So you can find information about both those programmes and about Speak Up on our website, which is albioninthecommunity.org.uk. So please check that out. The link will also be in the comments section now. So our key messages today have been around know the signs and symptoms, know your body, know what to look out for. If you're invited to screening, attend. Make sure you're registered with the GP and stay safe. So over to the comments box now. I'm just going to see if we've had anything through. Lovely. Okay. So first question. Okay, would I do my test at home or do I have to go somewhere? So it doesn't say which screening programme this is related to, but perhaps I could speak to Chris first to answer that question. So it's which tests are done at home and which tests do you have to do out of the house?
Okay, the poo test is done at home in the privacy of your own bathroom. That's the every 2-year one. For people going for the colonoscopies, the COVID tests are normally done at the hospital 3 days before your exam. The hospital you're having your examination in. So at the moment in Brighton and Hove, that's the Montefiore over in Hove, and we do have an occasional list at the county. But those tests are done. It's a case of you walk in, you have the test done, everyone's wearing PPE, you're wearing it, you go home and self-isolate, and then you appear for your examination on the 3rd day, having taken your bowel prep. So for bowel screening, the actual COVID test is done at the hospital, but the poo test is done at home. You don't need a doctor or a nurse involved, so you do it yourself.
Great. Thanks, Chris. And then Carolyn, you spoke about screening earlier. So could you just answer the question around what's done at home and what's done in a GP surgery or screening?
Okay. With breast and cervical, you're invited to both. And with breast, you attend a breast clinic, which is local to us, is in Preston Park. And for the cervical, you're invited to usually to your GP surgery, and it'll be undertaken at the GP surgery. But obviously, if you have any symptoms, you will not wait for screening. You will go to your GP if you're concerned about any signs and symptoms. But if you are invited, they're the places that you would go to.
Thanks, Carolyn. That's great. And our next question, and don't forget, if you have any questions, put them in the comments now. Next question, another one for Chris, bowel cancer. If you have a family history of bowel cancer, can you choose to get a test earlier than age 60? And if so, how early should people get tested, do you think?
People with family history don't currently come under the bowel screening program per se, but the GPs have a mechanism whereby if you've got someone within your family, then you should go and talk to them about it. Bowel screening doesn't cover family history, or Lynch is the other one that people are sometimes asked about. At the moment, there are moves to try and integrate that, but that will take a bit of time. But in the meantime, if you have a family history, you need to go and talk to your GP. And it's important if they identify that there is a family history. So you've got brothers or sisters, parents or children with bowel cancer, that they're also checked if that's appropriate. And the first place to go with that is your GP.
Great, thanks, Chris. Now that's all our questions. So I'm just going to ask the panel a final thoughts. If there's one thing people could take away with them today, what would it be? What would your message be? So if we can start with Kirsty.
Well, my message would still be, don't die of embarrassment. Don't be afraid. Grab hold of your symptoms and talk to your GP and catch your cancer early.
Brilliant, thanks, Kirsty. Carolyn?
Don't worry about a sign and symptom. Go to your GP if you are concerned, and please attend the screening programs because they're there to detect early stage cancers.
Great, thanks, Carolyn. Ian?
Yeah, I think early detection is so important. My tip would be if you spot some signs or symptoms, just keep a little note in a book or on a diary so that when you do approach the GP, you've got a little story there to tell him, because the first thing he'll say is, when did all this start? And it's good to have a little note to fall back on. So that'd be my tip.
Great tip, thanks, Ian. Chris?
Don't be frightened. 90% of the people we see, it isn't cancer. But peace of mind is priceless. Do your test.
Fantastic. And Steve?
Two things. One is that cancer isn't the end. It's just a better understanding of your body. And the second one is that a test, particularly if it comes back negative, is incredibly positive and it can help you rest assured.
Fantastic. That's a really positive message there. Thank you so much, everyone. Thanks to our panel. Thanks to everyone who's watching today. Remember, know the signs, see your GP if you're concerned, attend your screening, register for a GP. It could save your life. With the Speak Up team, if you'd like any further information about the Speak Up Against Cancer project and how we can support, please visit our website, and you can find us at albionthecommunity.org.uk, and stay safe.